Hello, I'm Brian Alexander. Welcome to my lecture series on how our beliefs affect our health. I often hear the question, why did I get sick? Or why do I have cancer or any other disease? The answer is not that simple because everybody is unique and so the reasons vary from person to person. Fortunately, however, basic psychology of people is the same, and so though the reasons for getting sick may be different, the methods for finding these reasons are similar. I once had a woman come to see me who had ovarian cancer. She'd already been in for 2 operations and was going in for a 3rd. The doctors were giving her a poor prognosis. Just prior to the operation, she came to see me for 3 days of intensive therapy. We worked on changing some of her limiting beliefs and helping her body learn to heal itself so she'd have a better chance of surviving the operation. The results were excellent. She came through that operation in better condition and with a faster recovery time than she had for either of her previous 2 operations. Now, her recovery was not due only to the work that we did, for she'd already taken charge of her life and became proactive with her disease. She did many other things to help her overcome her illness, but working on her limiting beliefs was an important component. The question is not, can I recover from this illness? The question is, what stops me from recovering? To answer this question, we have to take a deeper look at the choices you've made in your life. Everything is choice, and you are exactly as you've chosen to be. Now, some of these choices are genetic, and you have little say over them, but far fewer are genetic than most people believe or understand, and even some of those can be changed. The choices, or decisions we make, become our core beliefs. Many of your deepest beliefs are choices that were made for you, most before you even had the conscious ability to say, I don't like that choice. I once had a man tell me he was going to die when he was 65 years old. I asked him how he knew that, and he said, well, his grandfather had died when he was 65, as had his father. He decided that this was a trait of the males in his family. At that point, I suggested to him that his son would also die when he reached 65, to which he gave me a very shocked look. I asked him how long he'd been programming his son to believe that males in the family died when they were 65. I've never heard of a genetic trait that determines the age we will die, but I have heard of people who have programmed themselves to the point of hopelessness. By saying everything is choice, I'm really saying that everything can be changed. Even your illnesses are a choice. Now, I'm not saying that you consciously chose to have the illnesses that you have, although some people I've met have done exactly that. I once worked with a woman with lupus. I was working to try and find a way to help her body defeat this illness. We'd gotten so far in our work and then hit an impasse. At this point, I simply asked her, when did you choose to be sick? Without thinking, she responded, when I was 19 years old. I then asked her, what did she get out of this illness? To which she replied, I get taken care of. As it turned out, she wanted somebody to take care of her, and being sick was the easiest way to accomplish this goal. The choices we make and the beliefs created by them shape our lives. Perhaps the best example of this involves the story of Mr. Wright. In 1957, Mr. Wright was dying from cancer. In fact, at the time of this story, he only had a few days left to live. He had huge tumor masses the size of oranges in his throat, his groin, his chest, and in his abdomen. His liver and his spleen were enormous. Mr. Wright was desperately holding on with the belief that medical science would come up with a cure for cancer. And literally, on his deathbed, a cure was announced. A new drug called Crebiazin was developed and released for trial. Mr. Wright, having heard of this drug, begged with his doctor, Philip West, to give him the treatments. Unfortunately, Mr. Wright did not meet any of the criteria required for trial, but he was not to be denied, and finally his doctor gave in. As Dr. West wrote in his journal, it was Friday afternoon. He would give him a treatment, and by Monday, Mr. Wright would have passed on, and he could give the rest of the medicine to somebody who might really help. Monday morning, when Dr. West arrived at the hospital, he was astounded to see Mr. Wright walking up and down the halls, preaching the wonders of Crebiazin. Dr. West said he could almost see the tumor shrinking with his naked eye. In fact, Mr. Wright was able to be discharged from his deathbed in only 10 days, with virtually all signs of the disease gone from his body. For 2 months, Mr. Wright was disease-free, until the newspapers ran the story that Crebiazin was not turning out to be the wonder drug that they'd hoped for. Mr. Wright was destitute. He'd put all of his faith in this product. Within a few days, all the tumors were regrown and he was back in the hospital once again. Dr. West decided to try something radical. He told Mr. Wright that the newspapers had the story wrong. It wasn't the drug, it was the shelf life of some of the components that was the problem. He explained that a new and improved version was being developed and would be available in only a couple of days. At the appointed time, Dr. West administered the new drug and gave Mr. Wright a shot of fresh water and nothing more. But the new and improved drug worked even faster than the original. Mr. Wright was once again out of the hospital in only a few days, virtually all signs of cancer gone from his body. Mr. Wright continued to live disease-free for a few more months until the newspapers ran the story that Crebiazin was being removed from the market, totally ineffective in its fight against cancer. Mr. Wright was back in the hospital, all the tumors were grown, and dead in a couple of days. The question is, what killed Mr. Wright? Was it his cancer, or was it something else altogether? To discover the answer to this, we have to take a deeper look at how beliefs are formed and the impact they have. We have more control over these choices than we realize, but we have to understand them first. To learn the answers, tune into part 2 of Why Did I Get Sick?